Welcome to the Fuel the Fight podcast. I'm Lieutenant Colonel Nick Behringer. Today, we're going to talk a little bit about nursing, a nursing program. And I got a special guest on here. And, you know, you had just said it and you jinxed me. It's
nurse anesthetist.
Nurse anesthetist. Anesthetist.
Anesthetist.
Everybody try to say that at home
Yes.
5 times really fast.
Yeah, it's the first thing they teach you in school is how to say it. So, certified registered nurse anesthetist, you may hear us refer to as CRNAs. It's easier to say, roll off the tongue.
CRNAs, that'll roll off. And we have a program here.
We do.
But before we get into that, can you talk a little bit about your Army story?
Of course. So I come from a military family. My dad served in the military. Army was air defense. And then my grandfather was a Marine. So I grew up surrounded with the military, traveled all over the world, and was kind of inculcated with that. And when it came time to go to school is expensive. And I realized that I didn't want my parents to be completely in debt to advance my education. So I said, well, you know, I've been surrounded by the military. I saw great friends and relationships that my dad established. I have great friends. Why don't I join the military? I get to establish those great relationships, and I get the benefit of having my education paid for. So initially, I enlisted into the military when I was 17 years old, and I was, it was a few years ago. But I was 17 years old, and I was a 68 Delta, which is an operating room specialist. It was a wonderful job. That was my introduction into the OR and made me realize that I really loved being there. You either enjoy being in the OR or you don't. So it's important to know where you fall in lines with that. So a wonderful job to start, and then I went to nursing school. I was in the Army Reserves, and so I had a few mobilizations along the time, and so a 4-year degree took me 7 years to complete.
Nothing wrong with that.
Right,
Nothing wrong with that.
but I got there, I completed that, and then when I was finished, you know, I said, the Army's been pretty good to me. I'm coming up towards the end of my 8-year obligation. Why don't I commission, and I'll see where it takes me. So then I was a nurse, is working in critical care, and I got the itch to go back to school. And I couldn't really, I was kind of torn in different directions of what I wanted to do, but I missed being in the operating room. And so I looked into different programs, and the Army has the U.S. Army Graduate Program of Anesthesia Nursing, which is USAGPAN. And I said, well, why don't I try for that? If I'm going to become a nurse anesthetist, I want to be the best nurse anesthetist that I can be, and then still contribute and serve my nation, my country, and the best patients. So I applied, and I didn't think I was going to get in, and then I did. So then it got real. And so I went to the program, so I was considered a direct accession officer in 2012, and I sat in the seat for USAGPAN. I graduated 3 years later with my doctorate degree, doctorate in nursing practice, and worked a few various Army hospitals, and now have the option to come back and teach. And I've been with the program now for 2 years in the role as an executive officer and helping to advance our profession, increase mentorship of junior officers, and for me also to grow as a new field grade officer. So that's my story in a nutshell.
Wow. So kind of from that military upbringing, it's taking you here, and I love it. Like, because it's similar. I did a kind of a similar route in terms of, you know, it was great getting your education paid for, you know, all through the military.
Right. Right, and my case in point, so the Army has paid for my undergraduate bachelor's degree in nursing and my doctorate as well. And so I feel that with my exposure in the military, people saw a capability in myself that I didn't see. And so with the right pushing, the right mentorship, the right, availability, I've been able to accomplish much more with my education, with my professional career than I would have thought as a 17-year-old, you know, who said, well, I'm going to see where this takes me. And here I am 22 years later.
Goes fast, though, doesn't it?
It goes by very fast. It really does.
Can you give a quick overview of the USAGPAN kind of program?
Of course, I'd be happy to. So USAGPAN, like I said, is one of the 2 military education programs to create CRNAs, or nurse anesthetists. It's a 3-year doctoral program that's split into 2 phases. So phase 1 is primarily didactic, so that means classroom education and learning. And then phase 2 is 2 years long, and that's our clinical residency. And that's where you take what you've learned your first year and you really put in an application and you take care of your patients in the operating room providing anesthesia.
Nice. Where's the other one located at?
So the other one is in DC. It's at USU.
Oh, okay. So the two options there.
Correct.
What's the day in the life kind of for a typical USAGPAN student?
So it depends on what phase they are. Yeah, so the phases are vastly different. So I'll start with phase one. Mm-hmm. And so like I said, phase one is primarily didactic, and that's based here at Fort Sam Houston, San Antonio, Texas. And it's a Monday through Friday coursework. Starts at 7:45, and then they have class time and directed study until about 1700. Or for those that aren't familiar with military time, 5 p.m.
5 p.m.
5 p.m.
Yeah.
So the students or the learners, residents, they have the opportunity to schedule their physical activity and studying before class. After class, usually a combination of the two, because yes, it's strictly didactic, but there's a lot of hard sciences and challenging courses that are incorporated into the first year. And there's usually at least one exam a week, sometimes two. So you have to be able to balance the academic rigor of that and then all of the components of the military officership for our Army students. And we also have Veterans Affairs students as well. And so they have to make sure they stay in compliance with what's required with them from the VA.
Wow. And I will say this. So I just did the ACFT with the USAGPAN students.
Yes.
They are fit.
Yes.
Not that I should be surprised, but I mean, they were like really.
I know. We are blessed to have wonderful students from an academic standpoint. It's a competitive program to get into. And then I mentioned there's the officership component as well. And so we have been very pleased with the current officership and then the ongoing mentorship that occurs between our students that came into the program from ALFET. So it's the long-term healthcare and education training. So those are our students that were already on active duty. And then we have our direct accession officers that may have prior enlisted service or prior service in another branch. And we have some students that have prior nursing experience but no military experience. And so they come on to active duty to attend USAGPAN. And so now from day one, they may be a first lieutenant or even a captain, depending on how much constructive credit time they have from their nursing. And they're expected to be know and do, to wear the uniform and do it well. So there's a lot of growth on the military officership side as well as academia in phase one. But I'm glad you acknowledged our students. They're really terrific.
I was really impressed with the group. They were great, and they motivated me. Like I was like, all right, I gotta step up my game today.
Yes, every day, sir.
So we talked about a typical day in the life, kind of as a student in the program. Now that you're a CRNA, when you go out, what does a typical day look like? I know environments may vary.
Sure, of course. And I think I inadvertently left off phase two. So I'll talk about phase two, and then we'll transition to that. Yeah. So phase one, like I said, is the didactic setting, and phase two is the clinical residency. So they take everything that they've learned in phase one, and now they actually have to take care of patients. And so if you think about the day, it starts fairly early. Early on in the training, they have to get to the hospital earlier because it takes longer time. They get their assignment the day before of the patients they're going to care for, and then they get into the operating room and set up their room anywhere between 4 and 4:30 in the morning. With that, they go through all their equipment checks, make sure they have all their medication available, any additional devices that they need to take care of their patient. After their room is set up, they've done their checks, then we do a case presentation. And a case presentation is really a learning opportunity to talk about the patients and their plan, and to make sure that they've looked at the full scope of the patient, so all of their comorbidities, the surgical procedure that they're having, and to make sure that they're going to provide the most prudent and safe case. In anesthesia, the goal is to always have things go well, but we know Murphy's Law, things may not. And so the case reports give the students an opportunity to talk about what they would do in an emergency situation. So that way, if it happens, they're prepared. You plan for the best and hope for the worst, and then somewhere in the middle is where things work out. So after they have case presentation, they have to meet their patient, and then they also meet with the surgical team. The operating room typically starts at 7:30 in the morning, so there's a lot of things that have to happen before then. So if you're not a morning person, I don't recommend.
Don't be a CRNA.
Don't be a CRNA
if you're not a morning person.
If you're not a morning person. So 7:30 is when you take your first patient into the room and you induce their anesthetic. You take great care of them. You wake them up. You take them to the recovery unit. You make sure they're doing well. You go back to your next case, take care of your next patient. At the end of the day, you make sure that there weren't any untoward anesthetic events, meaning we didn't inadvertently cause harm to our patients. You get your assignment for the next day and you start all over again. So kind of like a rinse, wash, repeat.
Right. And so then I imagine, going to the next question, a day in the life of CRNA probably looks more like phase 2.
More like phase 2, not arriving to the OR quite as early because after 2 years of experience and repetition, it doesn't take you as long to make sure you have all of the safety checks in place. Things become a little bit more innate and natural. You're not doing the first time learning and you're more pulling back from previous experiences. And if something unusual comes up, of course, you're going to look at that up, research, or collaborate with your team. So similar if you happen to be stationed in a hospital. And as you know, we have various hospitals, we have large medical centers, we have small medacs, but CRNAs can also be stationed at FORSCOM units where you aren't in a hospital every day, or you may be stationed overseas, or you may be on a humanitarian mission, or you may be deployed. But the key concept of a CRNA is to provide expert austere anesthesia care in any setting that we happen to be in to make sure we have great patient outcomes.
No, that's great. What is kind of the most challenging thing you found being in a CRNA from like your experience?
Right. So I guess starting from when I was learning how to become a CRNA, and likely still carries on, is work-life balance. How do you make sure that you balance all of the responsibilities of one, being a learner as a student, or if you're a provider, how do you make sure you stay on top of the education and stay relevant and safe? How do you still make sure that you maintain all of your military officership components with that? And then depending on your family life, how do you make sure that you are a good family support person as well? So for me, when I was in the program, I was married, but I didn't have children. So my family obligations then were different than now,
Right.
where now I'm very blessed to have a 3-year-old and a 5-year-old and a loving, supporting husband as well. And so they all take their own time requirements, and you find that balance. But definitely trying to find the balance of giving equal parts to all, because in the military, you're not just your profession, you're an officer, you're a soldier as well. And you want to try and make sure that you take care of your family along the way, because eventually we will leave the military,
Yes,
right?
yes.
And so I want to make sure that my family is intact and still standing there with me when I'm finished. And same guidance for our students to come to the program. Know what you're getting yourself into, explain the requirements and the rigor to your family or support persons, so that way you can successfully complete the program and have them with you to celebrate in your success.
That is very important. I think, for maybe some of the young soldiers listening, they don't know, but you might want to save that for later and just, remember that
Right.
in terms of, particularly when we talk about, the family. They're going to be there after you leave the military.
Yes.
So, you need to prioritize taking care of them as well.
You really do.
What's the best thing about being a CRNA?
I have the best job. I really do. So being a CRNA, it allows me to take what I develop with my basic nursing skills, which is the care of the patient, and I now have advanced practice abilities where I can meet someone on a stressful day, because nobody is really excited to come and meet me
Right.
and have surgery, right? Most people are very nervous and they're dreadful about what could happen, and I have the ability to kind of calm their nerves, explain what I can do to keep them safe, take away their pain, and help them through a situation. And to me, it's very rewarding. So whether I'm in the operating room or if I'm working on labor and delivery, I'm there as part of the beginning of life, and I get to be a part of that as well. So it's to me, I find it very rewarding. Being an Army CRNA, I appreciate, because it allows me to practice within the full scope of my abilities, where with USAGPAN, we train our providers, our CRNAs, to be independent and autonomous practitioners, because we don't know where we're going to be providing anesthesia. I may be in a straightforward traditional operating room one day, and I may be in Honduras. I may be across the seas. or I may be mobilized for a humanitarian mission trying to take care of my countrymen here, as many of our CRNAs were activated at the beginning of the COVID pandemic.
Wow, so quite a lot of different ways you could be pulled and called on to serve. What about, the kind of the future? If you were to have a crystal ball and you look 20 years in the future, what does the future for the CRNA look like?
Sure. So I would say the future for the CRNA through USAGPAN would still be the same. The program has been around for 50 years. It's a well-known program, and it's a well-respected program. So we would continue to do the same thing, which is to create premier expert austere anesthesia providers. But I guess to more fully answer your question, I think with USAGPAN, we're always looking at new ways to incorporate best practices and current research into our practice to make sure we're caring the best for our patients. And so one of the there are many benefits to USAGPAN, but I think one of the great benefits is we have such a great emphasis on regional anesthesia and neuraxial techniques. We have a blessed and robust staff that gives our students plenty of hands-on opportunities to use ultrasound machines, to do peripheral nerve blocks, to do exams bedside for POCUS, FATES, and really trying to optimize our patients before we take them into the OR and provide anesthesia. And so I think as long as we continue to grow our program and stay kind of on the leading front with education, we're going to continue to make the best CRNAs, and they're going to take care of us as service members, our families, and then veterans.
That's awesome. You mentioned a little bit about the research. Is there anything, research kind of in your field currently that you see kind of coming down the pipeline that's of interest or more folks should know about?
Oh, sure. So with USAGPAN, we truly have a top-notch research program, and that's a large facet of what our program contributes not only to the Army, but to our profession nationwide. So there are current research that are evaluating different routes of administration for medications for ACLS protocols, so the intraosseous and the endotracheal route. So there may be patients that it's difficult to place an IV, and you take time to try and place a line where you could be providing medications to resuscitate and help these patients. So with previous literature, they're noticing in a pediatric model that if you increase the dose, then it's effective. And so we're looking at that with adult models to see if maybe we can change current ACLS guidelines to increase doses. And if we increase doses, then we can save lives. And obviously that is a key component of the healthcare medical aspect in the military. As we also know, there's an ongoing opioid epidemic as well. And so some of our researchers are looking at alternative opioid receptors so we can have that pain management component, but not have the bad side effects like respiratory depression and then dependence as well. And so that'll be another way that for us as anesthesia providers can appropriately manage care and pain intraoperatively, and then postoperatively to have a better overall wellness for our patients. With our program, we have a robust simulation as well. So our students in the first phase, they get to go through simulation of how you would interview a patient, how you would induce a patient, how you would care for them under anesthesia. So we're validating assessment tools that way to make sure we have inter-rater reliability and have good preparation for our students once they get to residency. Speaking of overall health of our force, so dietary supplement use is on the rise, whether it's beneficial for your health or deleterious. And so we have ongoing research to look at what the current dietary supplement use is of our own profession to see what we know about that and how can we best make sure that we provide good education to our patients and to our providers as well. The military recently put out a DoD instruction that the dietary supplement use is required education for all service members and any military medical treatment provider as well. So I think our research kind of goes in line with what the DoD is placing as an emphasis on that. And last but not least, I know I'm talking a lot about research, but I'm really proud of what my team is able to do and what they're able to generate. is that there was a recent project that kind of gave a revitalization of a draw over, and it is a field expedient device to provide anesthesia to our patients. And so a new clinical practice guideline was actually written because of this research with the draw over, and now follow-on research is looking at an oxygen concentrator to see if that works with the draw over and our current Hamilton ventilator, so we can make sure that we provide appropriate and safe anesthetic care with the right oxygen delivery in a far forward situation. Because if we can get oxygen to the patient and buy time until they can get to a higher echelon of care, we're saving lives.
Wow.
And so that's a quick synopsis of the research for our program.
No, that's a bit. I mean, a couple. So I have a question about that. So
Sure.
the oxygen. So that's the ability to kind of make oxygen for the patient versus having to bring bottles in. Am I understanding that correct?
So what we breathe right now, room air, is 21% oxygen, and for patients that are undergoing stressors with blood loss and trauma, and we want to make sure that we can give more oxygen to the tissues to prevent death, to the brain, to the surrounding tissues. And if you think about big, bulky oxygen cylinders on top of everything else you have to carry, one, it's awkward, 2, it's heavy, and 3, it's dangerous because it could be potentially a fire hazard. So the oxygen concentrator is a smaller device that does increase the amount of oxygen delivered to the patient with a much smaller unit.
Wow.
Yeah.
I get to check that out. I'm going to see this thing.
Excellent.
Very
Well,
very cool.
after this, I can get you in touch with my colleague that is proposing this upcoming research, and it's a great follow-on. And the wonderful thing with research is you create new knowledge, and then you create more questions.
Right.
And so then you follow on with that by answering those questions as well. And that is that falls directly in line with what we do as CRNAs in the Army.
No, and I love, as a dietitian, I love you mentioned about dietary supplements.
Yes.
And that I was actually surprised because I think your group presented at the grad school research day that we were here, and I love, because usually you think dietary supplements is going to be a bunch of dietitians, and I seeing the CRNAs up there talk about that, that was great. And then with the DOTI that came out, Dr. Patty Doyster has been on the, she's been doing that for so long, and Andrea Lindsay with Operation Supplement Safety. I know those folks, so no, that's awesome, and something we should look at in terms of, service members use at a higher rate than your typical civilian.
Right.
But again, is that good or bad? We should look at that.
Right.
Are they taking creatine monohydrate to throw the ball further on the ACFT or whatever,
Exactly.
or are they taking things that maybe they shouldn't, that aren't as helpful?
Right, and maybe if we can address what are some of the reasons that our service members and providers are maybe leaning towards supplements that maybe aren't in their best advantage.
Right.
What can we do to offset some of that stress, their workload or whatnot, so that way they don't feel dependent on that? So I love this interdisciplinary collaboration on similar information that has an outcome for who we care about, and it's our patients and selfishly ourselves, since we wear the uniform too.
Well, and that's part of the reason I like doing this in terms of talking to other providers is the more you talk to other providers, you see those interlocking kind of, sectors of fire that you never knew existed, just because, I didn't know CRNAs were interested in dietary supplements, and now I know, and, some other things. With folks being interested in your program, somebody's listening to this right now, and they're like, wow, that sounds really cool.
Because it is.
Because it is. Where can they, well, actually, let me take a step back. What can they be doing to prepare? Like if you're a nurse out there and you want to be a CRNA, what would you advise them to do?
So first thing I would say is grow wherever you are planted. So we know sometimes we don't get the job that we wanted. We don't get assigned to the duty assignment that we want to be at. Anywhere that you happen to be, make the most of it. Learn as much as you can wherever you happen to be. So if they know that they want to be a CRNA, they need to have critical care experience, but sometimes there are a few things you have to do before you get there. So if you find yourself on a med-surg floor, be the best med-surg nurse you can be, but be the best officer that you can be. Make sure you communicate to your charge nurse, to your OIC, to your rater, to your senior rater, what your short-term and your long-term goals are, so you can make sure that you get opportunities to excel in those situations. Because if you want to be a critical care nurse and you're a dud, in med-surg and you don't work hard and you don't play well with others and you don't grow your nursing skills, then it's less likely you're going to get the opportunity to go to the critical care courses that the military offer to allow you that experience to be able to apply to our program. So just be the best where you are, but communicate where you want to go so that way you can make sure you get those experiences. Study for the GRE. So the GRE is required whether you apply through the LFET program or whether you reach out to a healthcare recruiter. GRE is important. And I guess if you're already done with your undergraduate, you really can't affect your GPA. But if you know that your science GPA is a little low, take a graduate course and do well. Get an A, right? So don't just take it to take it, but take it and do well to show that maybe your life situation has changed from when you were, obtaining your undergraduate degree, but that you are able to do the academic and scholastic work of graduate education to kind of offset that. And what else would I say? And then just make sure that your family is well supported. Yeah.
No, that's solid advice. And that's for any program. I liked it. I mean, you could take that. It's like, hey, you're going to have to take the GRE, whether we can talk about the values of it or not.
Right.
But
It's required.
For right now, it's required. So study for that. GPA is going to be looked at. It's going to be assessed for any program you try to get into the grad school. And those sciences for, whether you're going to be a physical therapist, CRNA, dietitian, occupational therapist, you're going to have those sciences.
Yes.
So taking them and doing well. So no, that's great.
Right. And I think it's worth it to maybe put in that extra effort to make yourself competitive, because the opportunity of going to USAGPAN, I know I talked about how we are able to practice within our full scope of practice, but you can come to school and your focus is on education and learning. You're receiving a paycheck, you have health care, your family is taken care of, and so you mitigate those additional life stressors so you can really try to be the best learner you can be. And I mean, that's gold at this time. And then after that, you have a guaranteed job. So
the employment rate's pretty good.
It's 100%.
Yeah.
So you don't have to go on job interviews. You know that when you graduate, you have somewhere to work. And like I said before, we take care of the best patients. So that would be my recommendation for trying to set yourself up for success. To be the best nurse you can, learn as much as you can, know the processes, be aware of any upcoming board dates. So if you're on active duty, find out when the next LFET board is, keep track of all those suspense dates, and make sure you get everything in before the suspense date. Don't plan for the last date, because Murphy's Law, again, things will happen. And if you miss the deadline, then you'll have to start again for the next year. So try and make yourself successful with that. And if you are a civilian, or if you're on a reserve or a National Guard component, you'll be a direct accession, find a good healthcare recruiter. They know the requirements for the program, keep you on time as well.
Again, solid advice for any program right there. And,
Yes.
and I mean, LFET is such a great opportunity. I did it, and to your kind of point, I remember a lot of my colleagues in that program, because I was the only military individual in the lab that I worked in. They're working part-time jobs. They're working, you had all these other, like you were talking about, life stressors, and all I had to do was go to school.
Right.
I just had to go to school. I just had to focus on that. I didn't have to worry about my income. I didn't have to worry about loans. I didn't have to worry about paying it or TAN to get it. So
absolutely,
it's an amazing opportunity for the Army. I don't think enough people know about it. So take advantage.
Hopefully right now with this Fuel the Fight podcast, we're going to get that information out there.
Yeah, hopefully. Where can people find more information about the USAGPAN program?
So simple. It's a lot of letters, but if you type in USAGPAN into the Google bar, it'll take you to our website. Right now we're affiliated with Baylor. So that's the first link that pops up. So that's USAGPAN, or Uniform Sierra Alpha Golf Papa Alpha November.
Awesome. And I will put that link in the show notes. So if you're watching this on YouTube or wherever you consume your podcast, you can just click on that and you can go and learn more about the program.
Yes, they talk about the program requirements, and then gives you information about the LFET option, the direct accession option, and then also our VA as well.
Wow, that's awesome. Any closing thoughts for the group?
So I would just like to thank you for inviting me to talk about my program. I'm obviously very passionate being a USAGPAN graduate. I'm having the distinct honor and pleasure to come back and teach into the program and grow my profession. So I hope that the information gets out to the masses that are interested. Please apply. You know, a lot of times people are hesitant to apply to the program because it is known to be a challenging program, but anything that's worthwhile is challenging. But just know that we have graduates, we have successful CRNAs, and so if you're interested, apply, and we'd love to have you.
That's awesome, Nicole. Thanks so much for
Thank
coming
you
on the show.
very much. I appreciate it.
Yeah, and that is all we have for today. That is the Fuel the Fight podcast. We will have all the show notes and links in there so you can click on. You can learn more about USAGPAN and all that. Like, subscribe wherever you consume your podcast. Until next time.